Now, we've talked about the individuals, but what about employers and the employer mandate? Because a lot of people are concerned that too many mandates will probably just decrease jobs.
There's no employer mandate except for groups with over 50 employees. So under 50, there is an incentive for small employers under 25 by tax credits. They actually can receive a tax credit if they offer coverage to their workplace and meet certain criteria. Their average wage has to be less than $50,000. They have to pay at least 50% of the premium. So there's some stipulations in there that restrict who's eligible for those tax credits. But it is available. Between 25 and 50 employees, there is really nothing. There's no mandate. There's no incentive to buy coverage. So we'll just have to see. Over 50, there is a requirement to offer coverage, and there are penalties to employers who do not provide coverage and meet certain criteria. So we'll see how that all balances out. Most of the people, frankly, that are uninsured today are working in firms that have fewer than 50 employees. So it's hard to say, are we really going to accomplish what we intended, which is, you know, those 50 million people nationally that are uninsured, who are they? They're largely working in small businesses. They're largely lower income. Does this bill address those? Don't know.
Could this bill have an impact on what's been a somewhat successful program here in Oklahoma called Insure Oklahoma?
It could have some impact. We're in the process of researching whether Insure Oklahoma, whether those firms that are eligible and have purchased coverage through the Insure Oklahoma program would also be eligible for the tax credits, because part of that premium obviously is being subsidized or reimbursed by the state government. So we'll have to check on that. The plans, we have private plans that are involved in that, are likely to still be involved in the marketplace, and even with the changes that are contemplated under the federal law, those plans are still likely to be available. So it may mean that rather than the state reimbursing or subsidizing part of the premium, that the federal government will replace it. So again, we've got lawyers looking into that. There's some technical provisions of the bill that have to be reviewed to determine just how the two will merge together. But I think the intent of the state's program is in some respects mirrored in the federal bill, in that private plans are still available and there will be premium assistance for individuals who work for employers that are in the lower income levels.
Much debate during the debate on health care about state-based exchanges going to be able to go across state when it comes to health insurance as a cost-saving measure. That comes into effect in 2014 as well?
Right. The exchanges actually are a virtual marketplace, Rob. They're a web-based portal by which people can obtain information about health insurance plans available in a particular state, maybe enroll in those plans, enroll perhaps in Medicaid or determine your eligibility for a state Medicaid or Cerner Care program. It's contemplated that they'll do a variety of things to assist consumers as well as the insurance community in being able to offer information and enrollment opportunities for individuals in health insurance. The states are given a lot of latitude about how they roll out these programs, and so Oklahoma will be creating a stakeholder group to decide for ourselves, what do we want this thing to look like. So the good news is that this isn't a federal mandate in terms of you have to have a program that looks like this. The federal government, through the Patient Protection Act, has just said we think that there needs to be a mechanism by which people can get more information about health plans and enroll easily, create something. And so that's what will take place here in Oklahoma.
A couple of final thoughts. Can we add these health care benefits without adding costs?
I don't think so. I mean, I think long term we may see, by the addition of preventive benefits, if people utilize those coverage, we'll see healthier people. That's going to reduce costs. But in the immediate, anytime we add the scope of coverage, we're going to see increases in premium costs.
So no cheap health insurance unless we have cheaper health care costs.
I think that's right. There is no cheap health insurance without cheaper health care costs. And that's an issue that all states and the nation as a whole are going to have to deal with. And hopefully we'll see those kinds of discussions taking place. They're certainly taking place in Oklahoma. How can we make sure our citizens get the care they need when they need it throughout the continuum of an episode of illness or accident, but making sure that we're not spending money unnecessarily. That's the challenge before us.
Well, we certainly went through quite a bit of information today. Where can people find out more?
I really encourage folks to check out the Oklahoma Insurance Department website. It's oid.ok.gov. We provide links to Health and Human Services, to the Department of Labor, to the IRS, and to other reliable resources for information. You know, Rob, one of the things that's been most concerning about this bill is the amount of rhetoric and amount of false information that's out there. And so I encourage everyone to get the facts. We're going to be debating this bill for a long time, so with the facts and armed with the facts, people can contact their congressional member and have a conversation with them about the issues that are of concern or the things that they like under the bill. But it's important to know what's in it and get factual information to be able to do that. So our website is a great link to plenty of resources to get at the real information about this important piece of legislation.
Commissioner Holland, thank you so much for being here.
Thank you.